if it was your family member or loved one that was in our ICU bed, you would want them to live.
Being a nurse in today's world is extremely challenging.
Behind every COVID-19 data point is a nurse putting their life on the line to save someone else's. Good evening and thanks for joining us on this Friday. I'm Heather Lewis. Here in Springfield, one COXHEALTH nurse wrote a letter about her experiences. Our David Chasanoff spoke with her earlier today. David, what did you learn?
Well, Heather, she says she wrote the letter in hopes that people will understand how dangerous this virus can be.
We hold your hand as we tell you to fight this and that you have so many people who care about you.
Amelia Montgomery works 12 to 14-hour shifts in COXHEALTH's COVID-19 ward.
I've been taking notes, on my phone if I have downtime just in the last 6 months about the COVID patients we've seen.
There are heartwarming moments.
We listen as your family tells you over the phone that they love you and can't wait for you to get better and come home.
And devastating ones.
We watch as this virus kills you despite every fight against death. These patients are the most sick I've ever seen in my life. It's just an open ward of death and very sick patients.
Some patients are there even though they were careful but got sick anyways, and others did not follow precautions.
The frustration, we know that there's preventable things that we as a community can do.
But not everyone agrees.
There's a misconception that because of a higher survivability rate that this virus is not that bad. The virus is worse than they can imagine with some people.
There's only so much we can do as far as pleading with the public to adhere to these policies and recommendations.
It's been a struggle, a challenge.
Lindsay Skinner, a nurse at Mercy Hospital, faces different challenges.
Communicating with families as we aren't allowing many visitors right now due to COVID-19. It's really challenging communicating with our masks.
This is Skinner's 5th year as a nurse.
Probably the most difficult healthcare setting I've seen. It's definitely extremely challenging.
She says Mercy saw about 63 COVID patients today.
Our healthcare workers are suited up in large quantities of PPE. It's very physically exhausting.
And emotionally.
We've lost many patients, and that's really hard on the staff. There are often many coworkers in tears throughout the day.
But teamwork is what keeps both hospitals going.
We couldn't get through every day without each other.
Our team working together so closely, constantly, it's really allowed us to grow.
And both hospitals ask that you continue to wear a mask, wash your hands, and be socially distant. You can find Amelia Montgomery's full letter on our website at ozarksfirst.com.